Hello and welcome back to Trying to Figure It Out. This week on Trying to Figure It Out, we have with us Dr. Huang, who is one of the senior partners at the Reproductive Partners Medical Group. And he has been here for about 20 years, and this is one of the oldest fertility clinics in Los Angeles. We're going to be talking all things IVF, all things fertility today with Dr. Huang. And before we even get into any of the burning questions, I want to talk about my reason for knowing Dr. Huang, which is that I am actually one of his patients, and he froze my eggs twice when I was 21. And I think maybe right when I turned 22, we did my second round. So I have a personal relationship with Dr. Huang.
And kudos to you, because we don't get many kind of, 21-year-olds that are that progressive in thinking about future fertility.
Yeah.
Right. Most of the times we're 21, that's the last thing we're thinking about. But you and your OB were, very progressive. That's a great thing, because as we hear today, that youth is the best predictor of egg health.
When I was 21, I had just found out that I had PCOS, and my gynecologist, Dr. Aliabadi, had told me that one of the first things she wanted me to do was see you. And at the time I was 21, and I was like, oh my gosh, the worst thing that could ever happen to me right now is getting pregnant. Like, no, thank you. But that being said, she was like, I want you to meet Dr. Huang and get a consultation and just start thinking about your options, because the younger you do it, the better, which is what you were also just stressing. And in my mind, I was just like, I know I want a family. I know I want kids. Like, that's so important to me. So the minute that came into question, I came straight to you. Seeing a patient who's 21 years old, just diagnosed with PCOS, what is the reasoning you're using in your mind when you're encouraging me to freeze my eggs, separate from the fact that it's just a good thing to do at a young age?
Yeah. It's reassurance. It's an insurance policy, and it's an insurance policy on your reproductive health. And the reality and the best case scenario is you never need these eggs. That when you find the right partner and you're ready to start your family, my hope is that you get pregnant pretty naturally. All right, great. And these eggs will be saved for your second pregnancy or your third pregnancy. And depending on how big of a family you want, your fourth kid.
Yeah.
Does that make sense? So really, it's an insurance plan. And our hope when we freeze eggs is that we never need them. Fortunately for you, you have, a good number of eggs in the freezer ready if you and when you need them.
Can you just break down for me what egg freezing is, how it works, and at what age people should start planning to freeze their eggs?
Egg freezing, probably in the last 15 years. Okay, so hasn't been long as, the process of doing IVF, because IVF has been around for 40 years. IVF, and technically in vitro fertilization, is putting it with sperm. Freezing embryos, when you have an embryo, it's, 8 cells, can be 100 cells. An egg is 1 cell. So it's a single cell. So it's amazing we can even freeze a single cell. And it took the evolution of freezing techniques. So, when we first started freezing embryos, imagine it's like freezing something at home. Right. So it's a very slow freeze process. So in that slow freeze process, it takes a while, before something gets frozen to a state that we can thaw it successfully. Embryos, it worked. Survival is about 70%. So it took
for eggs or for embryos.
And so if you froze 4 embryos and you were ready to use them and you're ready to thaw them based on the slow freeze process, you might lose 1 in 4. Okay. Eggs, when we tried to use the same process but using the slow freeze, survival is like 10%. So it didn't make sense to freeze 10 eggs so that we might have 1 that survives.
Right.
So it really took kind of, improving freezing techniques to the point where we got to a kind of an ultra fast freezing technique. So still, we're getting to that 70 to 80% survival, and sometimes a little bit better. And with time, as we get better, now there's like ultra fast freezing techniques that will raise the survival of freezing eggs. But it took really understanding and improving freezing techniques to make it viable for freezing 1 cell.
What is the advantage of freezing embryos over eggs?
Right. So an embryo has 100 cells, right? So if you freeze an embryo and you thaw an embryo, and if 1 cell doesn't make it, you got 99 other cells that are next to it, and they're replicating and making up for that 1 cell that didn't survive. So nowadays, remember, it used to be a 70% survival. Embryo survival is about 99%.
Wow.
So it's pretty amazing. The other difference is that when you have an embryo, because it's 100 cells, we can do more with an embryo. So with an embryo, if you wanted to, if you told me, look, I want to test the embryo to look for chromosomal disorders, we can do that. If you told me that you and your partner both carry cystic fibrosis and you want to make sure the child doesn't have cystic fibrosis, We can do genetic testing and screening on the embryo to make sure the embryo doesn't have it. Can't do that for an egg because an egg is one single cell. So if you test that cell, there's no egg left. So the two kind of important things to keep in mind between freezing an egg, which is optimal for single women who aren't ready to commit to the sperm to fertilize that egg with. Freezing eggs is great because you have the advantage that these are your eggs. You can do whatever you want with them. These are your eggs. But know that survivability on an egg thaw is not as good as an embryo. And then know that when we freeze an egg, we don't know the quality yet, not until we put it with sperm and create the embryos, which you'll know for an embryo.
So when you just freeze your eggs, like my eggs have been in there for 7 years now, what happens when I thaw them out and then make them into embryos? Is there a period, like, can more damage happen to them in that window of time?
Not that we've seen. All right. So we have eggs that have been frozen for 1 year and 10 years do equally well. So, there's no freezer burn to eggs or anything like that. So once they're frozen in this very glass-like state, the survival stays the same, which is that 70 to 80%, whether we're freezing it for 1 year or 10.
And can you take an egg, turn it into an embryo, and then freeze it again?
Yes, you can. Yeah, because then an embryo has that 100 cells. So it's a lot easier to kind of freeze and thaw.
Got it. So if I still wasn't ready now, but wanted to know that know which of my eggs were good eggs or not, you could thaw them out, turn them into embryos, and then freeze them again. I could take them 10 years later.
And that's the first thing I'm going to recommend to you when you call me and tell me you have a great partner and you want to know what these eggs are. Because right now, how many eggs do we have?
28.
28, right. So we have 28 eggs frozen, but I don't know if 4 are healthy, 8 are healthy, or 12 are healthy.
Let's talk about that a little bit. What is the success rate for IVF or egg freezing?
That's very age dependent. So that's going to be the big caveat, is that when you're freezing eggs and you're younger, success rate is great. When you're younger, the chance of finding some healthy embryos is really high from the eggs that you get. And as you get older, it takes exponentially more eggs to result in that single healthy embryo. When you freeze eggs, it's an insurance policy, but never does it guarantee a pregnancy. But the younger you are, the broader that insurance policy is.
So walk me through the actual process of someone start to finish freezing their eggs. I can talk about my experience, but I'd rather you share what it's like for someone doing it.
Whenever I counsel patients and when I kind of go over the process with new nurses, I explain that whether it's an egg freeze or an IVF cycle, there's 3 stages. Okay. So I call them the 3 S's. All right. The first S is synchronizing your follicles. Doing an IVF cycle, whether we're getting eggs or creating embryos, is like running a race. Okay. And it varies how many runners are in this race. And when you're young, like you were, when you were 21, you had a lot of runners. So the first part of IVF is getting all these runners behind the starting line because we don't want to just get 1 egg if you have 15 to 20.
Right.
Okay. So the first part of an IVF cycle is synchronizing these follicles to get them all behind the starting line. And we use birth control pills, estrogen pills. We use some type of agent to keep your follicles all small and not let one get ahead. So that's the first part. That takes 10 days, 2 weeks, birth control pills or estrogen. Very easy. They're just pill form. At the end of that, we make sure they're all synced up. If they're all synced up, then the next stage is going to be stimulation. And that's giving you kind of the steroids to get them all across the finish line. Okay. We don't need 30 to cross the finish line because you can get very uncomfortable.
Yeah.
But we'd love 15 to 20. And so these are the shots that you had to take and women had to take. These are the stimulation medications. And that's 8 to 12 days. Okay. It takes 8 to 12 days to get these runners across the finish line. Those are the follicles. At the end, we're able to aspirate mature eggs. And the third part is as you get closer to that finish line, we also don't want you to ovulate.
Yeah.
If you ovulate these eggs, I can't get them. If you release them, you ovulate, I can't get them. Because if you ovulate these eggs, they're coming out of the follicles. All right. So I can only get eggs that are still in the follicle. Because when we do this procedure, which I'll go over, you're asleep, 10 minutes. We're using a needle to go into the follicles and drain the fluid and get the eggs out. If you ovulate, you're pushing the eggs out. Now they're kind of in the tubes and I can't get them.
Got it.
So, and that happens rarely, but when it happens, it's heartbreaking because you just spent 2 weeks on birth control pills, 10 days on the shots, and I'm not getting any eggs because you've ovulated. So the last part of any stimulation is the suppression. And that's just a shot that keeps you from ovulating. But those are kind of the 3 phases. And it usually takes kind of 4 to 5 weeks from beginning to end.
Yeah. I think I was pretty like on the nose with it taking about 4 weeks both times I did it. For me, the worst part was the bloating and the diet afterwards. Can you explain what the woman's body is going through after doing this process?
Women who have regular cycles and have a period every month, they ovulate 1 egg per month. And that 1 egg that they ovulate increases their estrogen a little bit, but nothing crazy. And then they ovulate 1 egg, and their goal is to get pregnant with that 1 egg. When we're doing IVF, we're not trying to get 1 egg, right? Remember, it's trying to get that whole, all those runners across the finish line. We're trying to get 10, 15 eggs. So when you make 10 or more eggs, you're going to feel very bloated. You're on hormones to promote the growth of not 1 follicle, but hopefully 15. If every follicle makes a little bit of estrogen, you're going to make 15 times the amount of estrogen that you normally make. Estrogen is a natural stimulant, so you're going to feel a little more energetic, a little bit more restless. But overall, most women tell us that elevated estrogen, they don't mind. What women do feel is the 15 follicles that are growing. So they feel more bloated and uncomfortable, and you felt that.
Yeah.
Even after we get the eggs out, the ovaries are still big. And so when I recommended kind of a certain diet, it was to help you recover quicker. And that is that kind of low, or in your case, I think I put you on a no-carb diet.
You did.
I did, right?
It was
because
horrible.
I wanted to, I know, and I'm sorry, but you got through it, you know.
I definitely cheated a few times.
So that might have added 1 day of recovery.
Yeah.
But usually kind of when we're getting 10, 15 eggs at a time, the recovery is kind of 1 or 2 days. The no carbs is just to kind of, lower some of the hormones that keep your follicles growing. And by being on a no carb diet, you recover faster.
Yeah.
And so that was the main reason I just wanted you to be kind of back to normal faster.
No, I know. It wasn't fun though. The bloating was real, and it really is uncomfortable. That's what caused any of my discomfort. It was like a more painful form of bloating because you really do feel it.
Yeah, because you were making 15 times the eggs that you normally make. So the shots might have been easier than the recovery sometimes. But the recovery was harder because you responded so well.
Yeah.
10 years from now, you're not going to respond. You're not going to have that ability to respond as well. And then you're not going to be as bloated.
Yeah.
So I usually kind of, counsel you in terms of the more bloated you're feeling, the better you're responding. The longer recovery, but you'll get more eggs. So it's kind of finding a fine balance. I don't want you too uncomfortable.
Yeah.
But I want to get enough eggs to make it worthwhile for you.
So I want to talk a little bit about infertility.
Sure.
Infertility is something we don't always talk about super openly, but we know tons of women struggle with it and men. How common is infertility really?
So usually we say about 1 in 7, about 15% of women. And I say women, but it could be the male factor too. So it's not uncommon. And the kind of stereotype is it's with older women, right? But if you told me tomorrow, Allie, that you were ready to start your family, I'd be like, sweet, but you don't have periods, right? So if you have very irregular periods, your issue is going to be helping you ovulate.
Right.
So for most women with polycystic ovarian syndrome, they don't ovulate. And so sometimes all you need is a pill. Okay, that pill is called letrozole or Clomid, and it's cheap and easy. The risks are low, and you're just ovulating. So, infertility kind of, 1 in 7 women or 7 couples kind of, have to at some point meet with, a specialist like myself or Dr. Alibadi, your OB, and figure out what's holding you back. All right. And the 4 common causes of infertility that, again, 15% of, women and couples deal with. 1, it's male factor. Lifestyle changes, what we eat affects sperm quality.
Yeah.
Right. And so sometimes it's not even you. We do your tests and you have regular cycles, everything is perfect, but the sperm count's a little bit low. And so we do insemination. Super easy, not expensive. So sperm is one thing we look at. Second thing, when a couple's trying to get pregnant, could be anatomy, right? And so if your tubes are blocked, we got to get around that. If you have a fibroid or a polyp, something with your uterus, we fix that.
Right.
Third thing is, what you might deal with in the future is that if you have irregular periods or no periods, you're not ovulating. So, if you say, look, I found an amazing partner, I'm ready to start my family, the first thing I'm going to ask you is that, how regular are your periods? And you're going to tell me they're regular now. I'm just like, sweet, call me in 3 to 6 months and tell me you're pregnant. But if you're not pregnant, then I got to look at other things.
Right.
So number 3 was ovulation. And number 4 is the reason why we met years ago. And that's the eggs, right? So That's the one thing we can't change. So unfortunately, as we get older, our eggs get older. Yours will always stay 21, the ones that we have in the freezer. But when you're 27, your eggs are 27.
Right.
When you're 35, your eggs are 35. When you're 42, your eggs are 42. And that's not to say that 42-year-olds can't have healthy eggs. They still do. But it's just harder to find the healthy eggs at 42 than 21.
Yeah. What kind of services are you able to provide to couples who are struggling because the male sperm is not good?
Yeah. So, and that's one thing that I would say in the last 30 years has changed the most. All right. Before, if sperm quality was an issue, there was very little that we could do.
Yeah.
Now, we can do kind of microsurgery to find sperm in the testes when otherwise, we would have told a couple that, hey, we got to use donor sperm. Like, here's a sperm bank. Go to the sperm bank, find some donor sperm, and we can get you pregnant. But now there's microsurgery that we can do. We can find sperm. We can do IVF. So even men who have no sperm or very, very little sperm, we're able to achieve success.
Do you think that the stigma around it is changing, where men are equally willing to put themselves out there to do IVF the way women are?
I still think that on the male side, we're a little bit behind.
Yeah.
All right. It's easy. Women will be, you have to do IVF. You have to do 8 to 12 days of shots. You have to have a procedure where we're going to aspirate the eggs. You're going to feel bloated for, a week after that. And women will be like, done.
Sign me up.
Sign me up. I can do it. Right. You did it twice. That's amazing. Tell a man that he has to, go through surgery and open up the testes and, look for sperm. And a lot of times they're like, do we need to do that? Are there other options? So it'll get there. It'll get there. But it's where the men are a little bit behind.
I feel like we hear a lot of people in the world talking about the struggles of IVF and how much of an emotional roller coaster it is for them. And you hear a lot of horror stories about it.
Right.
That wasn't my experience, but I also wasn't trying to get pregnant, and I was being very proactive and not reactive.
Correct.
So I'm just wondering if you can explain what that means when people are saying they had a horrible experience with IVF. What are they going through?
There's a lot of hope, in everything we do. And imagine going to a surgeon, because I tore my Achilles. If I went to my orthopedic surgeon and I was like, all right, I need to fix my Achilles. I want to be able to run and play basketball again. And they told me, okay, cool. But your success rate is going to be 65 to 70%. I'd be like, I'm finding another doctor. But that's exactly what we're telling our patients, is that every embryo that we have a chance of achieving, there's so much still uncertainty. As much as we can test, as much as we can screen, there's still 35% of unknown. And so at best, we're at 65%. It's expectation setting, but it's still not easy. If you knew you were going to have a 100% chance of success, you would go through, shots and bloating and nausea and discomfort and a hard recovery, knowing that you can have that success.
Right.
But that 65 to 70% that we're able to tell women on each embryo that we transfer, that's on a single embryo. So the cumulative success rate, 65 on top of 65 on top of 65, will get us success most of the times.
Yeah.
But it's still important to manage expectations, to help patients through it. I think it's really teaching them, guiding them, being there for them, the support both within the office and outside of the office, friends, your family that was there for you, help alleviate some of the stress and kind of the difficulty.
Absolutely. For someone who, is in a situation where they have a medical condition at a young age, but they can't afford to freeze their eggs, it's been 6 years since I did it.
That's right.
So has the pricing changed? Has insurance policies, have that changed at all from when I did it?
Yeah, we're lucky enough to be in a very progressive state. California is kind of very ahead of the curve when it comes to kind of reproductive health, so we're very lucky.
Yeah.
In July, this month, SB 729 is a law that's in place that's going to expand coverage for fertility.
Wow.
That includes fertility for, different populations, LGBTQ, also women who want to freeze eggs. And so this is going to improve access. Now, even though it was set to kind of start in July of this year, that might get pushed back a little bit just based on policies and stuff like that.
Yeah.
But that's going to improve access so that it's not going to be limited to those who can afford it.
Right.
At some point, we want reproductive health to be accessible to all.
Absolutely.
you still have to go through, you still have to have the time to kind of do it. You got to go through the, the ups and downs and the emotions and the shots that it requires to do well. But access is improving. And we're fortunate to be in California.
Yeah.
Can't say that for every state, but at least certain kind of progressive states is allowing access to be improved for, women of all ages.
Right. Why was it that when I did it, the only companies that really offered insurance were tech companies?
Yeah.
What is it about tech companies that they're offering that? Is it just the amount of money they have? Like, what is the reason?
I think it's part of that. But I also think that they realize kind of, that, fertility and reproductive health is an important asset for their younger staff. And I think that selfishly, I'm sure tech companies don't want you to get pregnant kind of, a year after starting,
right,
because then, you're going to take a little bit of a leave, you're less productive. So I think selfishly, tech companies are thinking for their benefit.
Yeah, protective.
Yes. And so it allows them to kind of keep, great staff and young women kind of productive. But I also think that, it's them realizing that this is, an important thing for young women.
Yeah.
So I think it helps them retain great staff. It allows them to continue to be productive. And I think it's also just promoting kind of reproductive health for the future.
Yeah. Let's talk a little bit about the future of IVF.
Okay.
Do you think that the overturning of Roe v. Wade will affect the future of IVF? And if so, in what ways?
Yeah, that's a great question. And the short answer is nobody knows. But what the overturning of Roe v. Wade did was it removed the federal protection of reproductive autonomy. Because with Roe v. Wade, across the country, women and couples could know that their reproductive rights were protected.
Mm-hmm.
What's changed now is the federal decision has now kind of been pushed so that states make the decision. Now, we're lucky. We're in California.
Yeah.
We're in a very kind of progressive state. And in California, there will be no difference. All right. You'll still be able to have access to all the reproductive care that you need.
Mm-hmm.
In certain states, what Roe v. Wade has the overturning of that has done is it has now put into question what rights embryos have, right? Mm-hmm. So whether embryos start life, at what point is an embryo kind of considered life? And so certain states, the more conservative states, Alabama, for example, mm-hmm. Has now kind of made it very difficult because providers of fertility care, doctors like myself, now we're liable when embryos are created, what rights do those embryos have?
Right.
And in conservative states like Alabama, those embryos may not be discarded. We don't know kind of, what to do with the embryos. We don't want to create too many embryos. What if the embryos aren't being used? So it's put doctors and providers like myself in a very difficult state, right, because of the liability issues.
What is happening in those states if someone tries to do an embryo transfer, but the embryo isn't a good embryo? Are they in a position where they're not able to do anything about it?
Their access to kind of, terminating a pregnancy that might not be healthy becomes very limited.
Right.
So what this does is it really affects access to care.
Yeah.
Because providers are going to be very nervous about, what am I going to do about this embryo? If you create an embryo and the embryo is not healthy, yeah, what can we do with that embryo? Right. So it's made what has been, pretty easy decisions very gray. Mm-hmm. And again, it really depends on kind of state to state. So the effect is it's limiting access in certain states. It's increasing costs in certain states because those states where access is limited, they're traveling. Right. Right. They're traveling to California. Yeah. They're going to New York and they're getting the appropriate care that they should receive. But it's adding cost and it's decreasing access. I mean, these are all limiting things that we don't like, right? Yeah. We want equal access. We want, women to have, the ability to kind of make decisions for themselves. And so the overturning of Roe v. Wade has been very limiting, and as I see in terms of, impacting kind of women's decisions for themselves. Yeah, absolutely. If someone listening is the same age as me right now, 27 years old, and they're wondering what they should be doing at this age, whether that's freezing their eggs or, starting to try to have a baby or doing certain things to be able to increase their chances, what is your advice for someone my age? Get information. Because somebody who's, 25, 27, 32, mm-hmm. There are always different variables. So this is where data like a follicle count is helpful. So some of the things that go into play kind of in making this, decision to kind of do anything proactive about your fertility include your age, which is probably the biggest, where you live, just because we just talked about kind of if you're in Alabama, your decisions may be more limited.
Right.
How big of a family you want, right? So, family is very important. You want to have a big family, do it sooner rather than later.
Yeah.
Okay. What type of relationship or what partnership you already have. So if you're single and you're 25, then you might want to do it sooner than, a 28-year-old who's in a pretty steady relationship, because they might be starting their family sooner than the 25-year-old who's still single. You want to kind of, have insight in terms of what type of family you envision in the future.
Right.
And when you want to start your family, because if each one of those things is delayed a little bit, you're a little bit older, you're going to start your family a little bit later, but you want a big family. Those are all things that would be helpful for me to be able to counsel you. Freeze your eggs sooner.
Yeah. For someone who's maybe not able to come in and freeze their eggs or isn't able to have access to this kind of care, what advice or tips do you have for people to preserve their fertility?
Great question. There's nothing you can do to kind of preserve it, short of kind of what you've done, is to, go on these hormones, get eggs, freeze them. But things that we can do to improve egg health for the future, eating healthy, being healthy, and those are things that kind of, dietary things have been shown to improve, like diets, that are high in antioxidants, minimal preservatives, avoiding tobacco, minimizing alcohol. Those things kind of in general lifestyle choices, are helpful in promoting good egg health.
Yeah.
So even a 29 or a 35-year-old who's not ready to freeze eggs, as long as they're kind of being conscientious of kind of healthy lifestyles, that's going to be promoting good eggs for when they are ready to get pregnant.
Yeah, that makes sense. I think that's great advice. Thank you. Okay, guys, we are going to wrap it up because Dr. Huang is a busy man and has things to do. But before we do that, I do just want to say this is a very important topic to me. It's something that's been a big part of my life for the last 10 years since I found out I had PCOS. Talking about women's health and what women can do to protect their health is so important to me. So I really appreciate you and everything that you do and what you offer to your patients. It's really amazing. And I'm grateful to be one of them.
And I'm grateful for you and doing this and just kind of getting the word out. And so I'm grateful for, being here.
Thank you. And thank you for all the advice and information. I hope you guys enjoyed this episode. I love you guys. Thank you.
Thank you.